Think of a 16-year-old student athlete who collapses on the field, not due to decades of smoking, but instead due to months of flavored nicotine vaping. At the hospital, doctors discovered the student's lungs inflamed, scarred, and failing, in a condition that could have been taken from the lungs of a person that smoked all of their life. Many people do not understand the impact of flavored vaping and nicotine inhalation on the lungs of teenagers and youth in general. Vaping-related lung injuries continue to rise, especially among youth. According to Dr. Ann Schuckett, a physician and epidemiologist, and the former principal deputy director of the Center for Disease Control and Prevention, the CDC, in the CDC's 2023 report, outbreak of lung injury associated with the use of e-cigarette or vaping products, these injuries continue to escalate. Whether you have vaped, know someone who vapes, or simply walk through vapor clouds in a public restroom, we are all affected in some way. This is not simply a not trend, it's an epidemic. Vaping is a public health crisis because it targets our youth through unethical marketing in multiple ways, causes serious health devastation, and is still remarkably underregulated. According to the American Lung Association, a leading national non-profit health organization committed to advocating for lung health and lung disease research, in their 2024 article, The Impact of E-Cigarettes on the Lungs, more than 80% of youth who use tobacco have started with a flavored product. With flavors such as cotton candy, mango ice, and bubblegum, flavors that are not made for adults, they are target for the youth. Vape brands and companies are working with vape influencers on social media to glamorize vaping for teens. In a peer-reviewed study, Teen Perceptions of Vaping, published in the Journal of Adolescent Health, Dr. Bonnie Halpern-Felsher, a developmental psychologist, Stanford University professor of pediatrics, and public health activists, discovered that teens incorrectly assume flavored vapes are less harmful, which makes them easier to get addicted. This is intentional. These companies know how to manipulate teens emotionally, to lure them in with identity, rebellion, and community, while hiding the addiction awaiting them on the other side. Once teens become hooked on the flavors, then comes the addiction and longer-term health destruction. The Center for Disease Control and Prevention, an agency of the federal government over public health, reported in its 2023 online article, Outbreak of Lung Injury Associated with the Use of E-Cigarette or Vaping Products, that over 2,800 people were hospitalized with E-Valley, or vaping-associated lung injury, and most were under the age of 25. Multiple deaths have been reported. Now imagine, at 18, being hospitalized and struggling to breathe, only to be told you will never get better. That's the situation for many teens today. In the peer-reviewed medical journal, Tobacco Control, researchers indicated that vaping increases risks of collectively bronchitis, chronic wheezing, and scarring of the lungs, all of which can last a lifetime. Additionally, the American Heart Association, a prominent non-profit authority on cardiovascular health, published a January 2024 article titled Vaping and Heart Health. In it, they reported that vaping raises blood pressure and damages cardiovascular tissue, and could therefore put young people at risk for health problems that used to be developed over decades of cigarette smoking. However, despite these harms, the laws meant to protect the public are ineffective and out of date. The U.S. Food and Drug Administration is the federal agency that protects public health, and the agency has not enforced a full ban of flavored vapes. Flavor vapes companies have labeled flavors such as Fusion or Ice to comply with rules. These misleading facts remain in the hands of minors. Mitch Zeller, a public health lawyer and former director of the ADA's Center for Tobacco Products, quoted in a recent FDA press statement titled "The Realities of Tobacco Control," stated that the regulatory framework has not kept pace with the realities of the marketplace. Translation: the laws don't work and vape companies are exploiting every loophole available. If there was stricter and consistent enforcement, access for youth will be eliminated. But yet, we continue to see teens addicted in bathrooms, TikToks, and behind bleachers. So, what do we do in response to this increasing public threat to health? As I have demonstrated today, vaping is a public health crisis designed for youth, loaded with hidden health risks and the product of ineffective regulation. If your little cousin or your best friend was vaping every day and didn't know any better, wouldn't you want to warn them just in time to save their lives? We cannot stay quiet. I encourage you to advocate for more clear warning labels, support a total ban of flavor vapes, and make sure you educate your community. As Dr. Jerome Adams, an anesthesiologist and the 20th Surgeon General of the United States, said in a 2020 government report titled "Facing the Epidemic," the Surgeon General's advisory on e-cigarette use among youth: nicotine is highly addictive. We are facing an epidemic of youth vaping. We can and have to get our arms around this issue today, not tomorrow. So, I leave you with this. Now that you know the truth, what are you going to do about it?